Good afternoon, everyone. I am going to give people a couple more minutes to join on, and then we will get started since we have a little bit of a longer presentation today. If you're interested, you can share your name, pronouns, your role, and organization in the chat, and we'll get started soon. Okay. All right, in the interest of time, we're going to get started. Welcome to the Public Health Emergency Unwinding. We are going to be going over a couple different things today. We're going to talk about the remaining renewals beginning in June, the OHP Bridge launch on July 1, and summer benefits, including EBT. And I'm going to go ahead and pass it over to Sean from OHA to get us started on the presentation.
Thanks a bunch. And our colleague Lily Bork is going to be pulling up the slides for us in just a second here. Thank you. Alrighty, well, my name's Sean McNulty. I'm OHP's Member Communications Coordinator, as well as the co-lead for comms for the Unwinding. So we're here today to be presenting our Oregon Health Update series. If we can go to the next slide here. So welcome to our first of the formal Oregon Health Update meetings. This is a continuation of our previous COVID-19 Pandemic Health Unwinding webinar and office hour meeting series, which we combined into one meeting going forward, as well as reframed to be focusing on topics that are not just unwinding, it's really focusing on what people working with members need to know at that time. So we're basically opening up the floor to other topics that are relevant to you at the time. Right now, it's really hard to separate unwinding and the OHP Bridge launch, for instance, and we want to be able to continue to bring those topics to this group and continue the series since we have pretty good engagement in these meetings. So OHP Bridge is going to be a major feature over the next few months, and then we'll rotate to future topics as we head towards, for instance, the rollout of the waiver housing benefit and things like that. We're just going to be a general news venue for different programs to come in and bring their experts in, so you can have some time to ask your questions to the program experts and get those responses both live and have a venue for email responses too. So really hoping this will be continue to be a productive venue for answering your questions, as well as for us to get feedback and hopefully adjust the system and make it work better for members. So we can keep going. Our agenda for today, we'll start off with some pandemic unwinding and renewal updates, then move into some updates about the upcoming OHP Bridge launch, head into some news about other benefits. Today, we're going to be talking about the summer EBT program, as we're broadening the definition of what counts as an OHP benefit to include the waiver services like climate, housing, and food. We wanted to continue to bring in the food benefit area in preparation for expansion into that area. We've got a bunch of questions from the last webinar and that we received through email in between these two webinars that we're going to go into and respond to, and then we'll open it up to further discussion for you to bring additional questions on other topics. So let's dive right in and head into the unwinding section. So next slide. Right now, we are having a bit of a data issue with our main data dashboard that is the source of most of my numbers for these presentations. Right now, it is not displaying the not started category. That is the number of renewals that are remaining for the remaining 4 months of the unwinding project. So we don't have the exact number there. We may see some data shifts there. It is currently in the works for a fix, though. They're fixing the parameters of the data that gets pulled into that dashboard. So we do have that asterisk on all of our other things that there might be some shifts once we get that restored and fixed. So we still wanted to share the data we have available right now for transparency purposes and whatnot. So we'll head into that in the next slide. At the moment, we are 90.6% complete with the entire renewal process. We did see that number go down a little bit over the last month as more renewals were put back into the process or reconsidered or something like that, using that 90-day reconsideration period that people have, even if they didn't respond to cases and whatnot. Out of the renewals that have completed the process, we've got 82.3% of them that are continuing benefits. That's a bit up from last month, which is good news. We've also seen about 10,000 people have their benefits reduced. That means going from full OHP to a Medicare savings program or some other medical benefit where you don't have the full OHP you're keeping, but you're keeping some form of coverage or a Medicare savings program. That number did go down by about 4,000 since we met last month, so we've seen some restorations there additionally, so more people have got their cases reopened. And then for about 222,000 people, 16.9% of the total, we have had their benefits end, and they're needing to look for other coverage, either through the marketplace, employer coverage. If they have Medicare available to them, they're figuring out their other options. If we can go to the next slide, that 16.9% closure rate does keep us in the third place for national comparisons and whatnot. So out of that remaining group, we don't have the exact numbers of how many people remain in there. Last we checked, it was about 120,000 for your perspective. That group includes people who are going to start coming up for renewal next week is the earliest batch of them. There will be 3 groups of people within that whole subset. First off is the Oregon Supplemental Income Program medical people who are either legally blind, have a disability, and or are 65 or older, and are getting OHP with some long-term care services as well involved in there. They're qualifying based on their limited income as well as their limited financial resources, which is something we're going to see pretty heavily in this group. Then another group that is in this summer renewal population is going to be people whose benefits were restored and their renewals were rescheduled as part of a federal request to review the automated renewal process. There's a big system update that changed how we look at renewals at an individual versus case level that happened in May. You might have seen those new notices and whatnot. The people that were affected by that issue are in this group as well. And then the third portion of them is people who are neither of those 2 groups, but are the family member of one of them. So there's someone else in the household who is affected by one of those 2 issues, and then the household members are also going to be renewing at the same time. So that's how we've got in the roughly 120,000 renewals that are coming up over the summer. We also wanted to caution that there are some other renewals that are still happening on a 1-year schedule. So since we're more than a year past the beginning of the pandemic unwinding project beginning, we're having some people go into their second renewal since April of last year. We're in the process of converting to a 2-year renewal cycle for most members. The ones who have continuous eligibility, we're trying to align with those continuous eligibility periods. We have a lot more about this whole topic later on in the question section, so I'll get to that later in there and not dive into that now. Next slide. So next week is actually when we will start seeing some letters go out to members in this June batch. These are the timelines for each of the 4 waves that we're dividing those renewals up into. So for the people that are getting them next week, they're going to receive the letter in June. They will have until the end of September to respond to that renewal. So that's your timeline for anyone who's getting them next month. Then if they don't respond by that point, they get their termination notice at the beginning of October, which would close at the end of November if they still haven't responded. Then the last element on there is that 90-day reconsideration period, where people who haven't responded to the renewal process can still provide the information that we're missing and reopen their case without a new application if they get in touch with us during that time. After that, they'd have to reapply. You can reapply at any time, and we're expanding coverage to more people. So we'll get into the OHP Bridge topic shortly too. But we've got those 4 renewal waves staggered. You'll see the first wave go out in June next week, and then we'll have 4 subsequent, or 4 total waves, so 3 more subsequent after that over the next few months. Next slide. We also wanted to caution that even though this is outdated data based on that dashboard, we're waiting that update and whatnot, the demographics of this renewal population are significantly different than OHP members generally. We are specifically seeing way higher numbers are either over 65, which is 43% of the total previously, or they have a disability at nearly 2/3 of the total. So we're going to see a lot more of those groups in this population. We're going to see a lot more Medicare assistance, a lot more discussion with their case managers about financial resources and things like that for this group. We also wanted to note that since this group has specifically been restored or had their renewals rescheduled, many of them closed previously over income or resources and then were restored since then. If their financial resources and income haven't changed since then, in many cases, we would expect the same outcome. So we might see a higher closure rate among this group over the summer. We're also likely to see somewhat higher, it's going to be more common to have to provide a full renewal as opposed to passively renewing and approved among this group too. So the main thing we're doing for this group here in terms to make this go well for them is spreading out those renewals. You saw those 4 months of waves we've got staggered there. That total 120,000 population would have been like 1 month of a 1 month caseload for us earlier in the pandemic. We are staggering that over 4 months to drastically slow it down and make sure the case managers for people who have long-term care services and whatnot have the time to be able to reach out to those members. They will be reaching out to the members that are assigned to them specifically and have that personal relationship with the member. So we've got some extra support happening from the case manager level. That is often one of the people that you're going to want to connect the member to if they have very complicated questions about financial resources and things like that. So we will have some additional materials coming out about how to assist with questions by the next month's meeting. So looking forward to rolling that out as this population will have some specific needs and whatnot. Next slide. Other thing we mentioned and went into depth on last month was there's a bunch of changes that happened to the renewal system back in about May 16th, I believe. The first major change was changing how we do passive renewals, which is that step where we try to renew a case automatically based on the information we have on file without having to require a response from the member. Previously, that step was done on a household level. So if an individual member, like a child in the household, could have passed the automated renewal process individually, but a parent couldn't, the whole family would then get a renewal packet and need to respond to that. If they didn't then respond to the packet, the whole family could close. The federal government told us we need to change how that works. So those individuals who could keep the renewals without having to respond don't have to respond and aren't at risk of closure. We got that fixed. That does result in a lot of changes to how the renewal notices look and whatnot now that we're having to do it at an individual level. We also made a bunch of changes to try to reduce the length of those notices and make them easier to read because that individual versus household level does result in some additional length in the notice with each person having their individual section now. So taking that opportunity, we also made a bunch of other changes responding to feedback from partners through this venue about a year ago. We had heard a bunch of difficulties with the renewal process, situations that were confusing for people, and tried to address those as best we could using this opportunity. One of the big ones is that we're no longer allowing terminations or reductions without allowing the individual a chance to review and confirm the case information. So if they're over income and come up for renewal, we will no longer passively terminate them. We will give them that opportunity to respond and let them know that their income has changed, or let them know that, or for them to verify that it's accurate, and then in which case we would proceed to the correct termination. We've also made a bunch of changes to requests for information at renewal that will condense the notices into one notice and prevent them from being 2 separate notices that arrive separately. It'll also just make that situation much clearer to people when they have been renewed and also need to provide some information to complete the renewal process. That's going to be explained in a much clearer situation for the situations that it remains in. On the notices themselves, we made a bunch of changes to make them easier to read, in addition to focusing on the benefit category rather than the coverage type or the program itself. We can go to the next slide. We've got a graphic on here showing what this new notice looks like on the page 1 portion. As you can see on the right side here, we've now got a color-coded page 1 summary that puts all the critical information for the member up front for the whole family. So on this notice here on the right, you've got the person with the orange box. They need to respond to the renewal. We've got that kind of color-coded for them as something they need to take action on, compared with their under 1-year-old child there has the green box and is good to go. The renewal is complete. No action is needed for that person. So we're putting that information up front on page 1. No need to dig into that to get the general summary of what's happening. Then you dig into the individual pages for what's happening on each individual level for more detail if you need that. We've got some example notices now available. Those are linked on the slide here. These will all be shared out after the meeting as well. We're also updating the notice guides that explain to partners how to read these sort of things. And so those will be coming out over the next month. So just wanted to take a moment here at this stage, next slide, if we can, if you have any feedback on how these notices have been received from members so far, we're hoping they're easier to read. We know that it's going to be a work in progress and there will be further adjustments to these notices needed. A lot of the changes that resulted in this pretty transformative change to the renewal process originated from this group. So we really value your feedback as you are working with members with the new notices. Please let us know what areas are still confusing and how we can continue to improve those. If anyone wants to weigh in at the moment, just wanted to provide that opportunity. Otherwise, we'll be handing over to OHP Bridge next.
We don't currently have any questions in the Q&A.
Looks like some positive comments in the chat though, so glad to hear that.
We love to see that. All right. Thank you, Sean. So for those of you who have not met me before, my name is Katie Waldo. I use she, her pronouns, and I am the lead project manager for OHP Bridge. And we've got a couple of updates for you today. So we can go to the next slide. So really quickly, before we sort of dive into some of those updates and questions that you all had, we just wanted to provide a really brief summary for those of you who might not be familiar with OHP Bridge. So this is a new benefit for adults with higher incomes. In order to qualify, you will have to have an income no higher than 200% of the federal poverty level. You'll need to be between the ages of 19 to 64, so that includes your 64th year, as well as not have access to another form of affordable health insurance, and you will have to have an eligible citizenship or immigration status to qualify. OHP Bridge is meant to be almost exactly the same as OHP Plus, so there should be a fairly seamless transition there. And it will be free to members, so there will be no copays or deductibles or similar costs. So you can go on to the next slide. So the process of getting federal approvals for this program requires a couple of steps. So we did recently get formal approval from CMS on our Basic Health Program Blueprint late last week. And that's the first step in a series of steps to establish this program. So we still do have a couple more to go. This includes getting approval for our basic Medicaid application, which is part of an 1115. And we're in the final stages of that. And that is to ensure that we are able to maintain the right to choice between CCO and open card coverage for American Indian and Alaska Native members. Once we have that, we'll be making an announcement and a celebration for the full approval of the OHP Bridge program. And we're hoping to implement, the plan is to implement both programs on July 1st. So we're planning to do a larger announcement and celebration around that time. You can go on to the next slide. So just to kind of reiterate and clarify the separation. So we have OHP Bridge, which is sort of the umbrella for these two sub-programs underneath. So we have OHP Bridge Basic Health Program. This is managed exclusively through CCOs and does not have an open card coverage. And this is where a majority of OHP Bridge members will receive their benefits. We also have this smaller program called OHP Bridge Basic Medicaid, which is that 1115 piece. And this again was built to ensure that we maintained the right to choice between CCO and open card coverage for American Indian and Alaska Native members. So it is only available to those individuals. You can go on to the next slide. There are a few, so the benefit package between these two programs will be the same, but there are a few minor differences that we want to line out for you here. So the first is with its coverage period. And so OHP Bridge BHP or Basic Health Program will have a 12-month coverage period. So members will be protected during those 12 months from losing coverage due to income increases. That being said, they will still potentially lose coverage if they no longer meet other non-financial eligibility, such as if they turn 65, if they have a change to their immigration status that makes them no longer eligible, or if they receive access to minimum essential coverage during that period of time. OHP Bridge Basic Medicaid will follow Medicaid rules, so they will have the standard 2-year continuous eligibility that was established through our 1115 waiver. We can go ahead to the next slide. So just another reminder, so we do have the program launching soon. It is intended to launch in July. That is when new members will be able to start applying. So members who are moving on to OHP Bridge will receive 2 notices in the coming months. So in mid-June, so coming up here soon, we'll send out a notice that has custom language related to OHP Bridge and its transition. In the late June period, they'll receive a notice of eligibility, and we have an example of that at the link on the screen. And I think, am I correct in the slides will be sent out after this? So they'll, yes, great. Thanks, Sean. New members will also be receiving information through their CCOs, so that will include an updated handbook with the OHP Bridge insert. And we do want to reaffirm that members moving from OHP onto OHP Bridge will be able to use the same ID cards. We really are trying to find as many ways as possible to make this feel really seamless for members moving between the 2 programs. Okay, we can go to the next slide. So we have been kind of viewing enrollment into OHP Bridge over the next few years within 3 sort of categories. So we've got individuals who will be moving from an uninsured status, and they can start again applying in July 1st. We also have individuals moving from the marketplace. So individuals who are currently covered on the marketplace between 138 and 200% of the federal poverty level will sort of move over the most gradually. So they can maintain their coverage through their coverage period if they do not, have any updates related to income, changing address, things like that. And so we assume that transition will happen sort of gradually over the course of 3 years. We also have individuals moving from the Oregon Health Plan. So this is again that same category of income will be slowly moving over following the end of the public health emergency, specifically from the temporary Medicaid expansion, and they will move over on July 1st. I think the next slide I'm handing it back to you. All right. Great.
So we wanted to go into a little bit more detail on that last group, the ones that are moving from OHP to OHP Bridge this month. So those are the people that are going to be getting those notices as early as next week, honestly, is when those might be sent out. So people who are on the MAGI Expanded Adult Program, which is the name for the temporary Medicaid expansion, or the people that have kept OHP during their renewals since the pandemic unwinding began until OHP Bridge launches. Basically, in late June, or next week, we'll send the initial notice, but over the next few weeks, we are going to start sending them those notices that they're moving to OHP Bridge July 1st. Though there will be some groups that are not eligible for that. There may be some people who have had income updates happen since then and are now eligible for OHP again, in which case they're going to get rescreened for OHP, moved back to OHP. There will be a small subset of people as well who do not meet the OHP Bridge eligibility criteria. There will be a small number of people who have turned 65 since joining the program. There will also be a probably very small number of people who have lost their immigration status or have otherwise had changes. That's probably going to be more information correction than anything, because people who are outside of the traditional Medicaid rules, which means the 5-year bar, 5 years of documented immigration status required to qualify for full OHP or a refugee status or something like that, did not qualify for the MAGI Expanded Adult Program. I do want to thank the questioner last time who brought that issue to our attention, and we will be getting outreach lists ready to go. That'll be a topic for next month. Then the majority of people who will actually fail to transition would be people who have other health coverage. So if they're on the MAGI Expanded Adult Program, they're allowed to have other health coverage. OHP Bridge will not offer that option. So we may see some people who have other health insurance on this MAGI Expanded Adult Program have a closure instead of transitioning successfully to OHP Bridge. There's one other group in this whole topic that we wanted to bring special attention to on the next slide, which is a group of people who are going to be moving from open card to a CCO. This is specifically going to be the OHP Bridge Basic Health Program members, so the ones that aren't members of a tribe. In some situations, OHP will grant people an exception, or known as an exemption, from coordinated care organization enrollment based on special health care needs that can't be met by the local CCO. OHP Bridge Basic Medicaid does not offer this option. These members will end up having to transition to a CCO on July 1st, and they will lose that exemption that previously kept them out of the CCO because of services that were inaccessible through a CCO. We are working with the CCOs themselves and their care coordinators and whatnot to try to get active outreach going to this relatively small number of members. Our best estimate right now is about 115 people. In the unlikely event that you encounter one of these yourselves, we really want them connecting with those CCOs. CCOs are charged with that, helping members connect with the services they need in their network. So their care coordination functions are really the best bet to pursue all available options to keep that care plan as minimally disrupted as possible if someone has a network change coming up in July. So we'll share more information about that through the various channels, but we're working on the CCOs to get some active outreach happening from their care coordinators, as well as outreach from Essentra is our open card care coordination function. So we're trying to provide some extra support to this small group of people that will be moving from open card to a CCO and will predictably have some care difficulties. So I wanted you to make y'all aware that that's happening. Okay, otherwise, then we're going to head into some partner resource things about OHP Bridge. So the baseline place to start would probably be the OHP Bridge training for partners. This has been available on demand since May 15th. I think we've had a couple hundred people take it so far, so kudos if you already have. This would really be the main place to start to get primed on how to handle those client questions that might be coming as early as next week. We strongly encourage you to take this before launch. Here's the links here. That is, well, we got a question about the link in the question section. I'll leave for there. Next slide. The other thing we wanted to show off is the OHP Bridge Partner Toolkit. We just rolled this out last week. This is going to be one of the main tools for you as partners to educate you about what this is, give you the key messages we want you to share with clients. It's got some graphics that you can use when signing up a client to explain some of the more complicated topics, as well as a resource document that's like a 2-pager primer about OHP Bridge. That's available in English and Spanish. Well, the toolkit itself is English dominant with all the resources available in Spanish. We use the same model as the Healthier Oregon toolkit for that. We did want to take a quick look at that. If I can have the screen share control real quick. Lily, if you can stop screen sharing for just a second. Thank you. Alrighty. So we've got our OHP Bridge Outreach Toolkit. This is the first material we'll have coming out for partners to support outreach. This one's bridge specific, so not general health coverage outreach focused. We've got another project for that. So it starts off with just overview of what the toolkit itself is. We've got some background information about eligibility, benefits, and moving to OHP Bridge respectively. These are very similar content to what's in the training, but this is really the summary that we'd want you to have on hand and be really well prepared for. Then we've got key messages to share with members directly. We've got a whole partner resource document here. All of these link out of the toolkit itself. So we've got about OHP Bridge, key messages like being free to members. One of the main reasons people don't apply for OHP when they're eligible is because they think it'll cost some money. So that's why we have heavily highlighted that this is free. We've got some basics about what's covered, how to use your benefits, on these sort of things that you might use while working with a member directly. We've also got some graphics in there, for instance, a comparison graphic that compares the different types of health coverage available through various systems. So OHP, the marketplace, and a comparison between those two different variations of the OHP Bridge benefit category. There's the 2 programs within it, basic Medicaid, basic health program. The benefits look the same, but there are some differences for instance, that coverage period we explained earlier. And then we are going to continue to be adding to this. We've also got a graphic for when does coverage start for the basic health program component. There's a basic Medicaid graphic coming as well as a other health coverage availability graphic that's getting added to this in the coming weeks. So that's a quick show off of the toolkit there. That is all available through the OHP Bridge website. I encourage you all to check that out and keep coming back as we add more content to that over the next month. And Lily, if we can resume the presentation. Thanks so much. Alrighty, next slide. So the other component besides that OHP Bridge specific content we've got there in the toolkit is going to be an outreach campaign that's generally focusing on the uninsured. Most people who are uninsured and eligible for one of our programs aren't going to know which program they're eligible for until they apply. So we wanted to aim generally at the remaining uninsured who are eligible for something, whether that's OHP, OHP Bridge, or the marketplace. Based on the latest data we have available on the uninsured population, nearly 70% of the people that were uninsured were eligible for one of our programs. We have since expanded eligibility to more people through things like OHP Bridge and Healthier Oregon since then. So we really want to try to get that anyone who's uninsured to take action and apply during this. If we can go to the next slide. As a result, a lot of our materials are going to be very generally focused. So we're making some health coverage outreach materials, flyers, back cards, that sort of thing, social media posts. This is going to look very familiar to you if you saw our Keep Covered materials for the unwinding, that are aimed at promoting health coverage generally in 2024. So it does have a mention that more people with higher incomes now qualify for OHP. That's kind of one of the highlight messages for OHP Bridge outreach. It's in there, though we do want to have that general presentation that even if you're not eligible for free coverage through OHP, you are likely eligible for financial help on the marketplace. So you're going to see this health coverage, get it, use it, keep it, ad campaign, as well as the partner materials. There'll be a second toolkit rolling out on that OHP Bridge site for the general health coverage outreach, as opposed to the OHP Bridge specific things, which you'll really only know once you apply or have a pretty thorough conversation about eligibility with someone. So hoping to support that general outreach lens, as well as the need to support the OHP Bridge clients specifically. So that's what we got coming on the OHP Bridge communications front. I think the last slide here is just ask if there's any feedback or additional supports that would be helpful for you and your team to communicate this to members and whatnot. We just want to keep that feedback channel open. If we don't have any questions, otherwise we'll be handing over to Stephanie to talk about food benefits.
We have a couple of questions about funding and co-pays, but if you prefer, we can answer that when we hit the Q&A section.
Catching up in the chat here, just a second. Let's address them in the questions section. It'll be coming up like 4 slides from now. And then we're welcoming Stephanie Cook from ODHS.
Hi, thank you, Sean. Good afternoon, everyone. My name is Stephanie Cook, and I am with the new summer EBT program, which I'll be sharing a little bit of information about today. Sean, do you have the slide deck, or would you like me to share my screen? Or
Lily does.
Lily. Okay, perfect. I will wait for Lily.
Looks like it's displaying.
Is it? Oh, there we are. Okay, wonderful. Now I can see it. It wasn't going there for a second. Alrighty, so we have a brand new permanent food program starting in Oregon this summer. It's called Summer EBT, and it is rolling off our previously initiated program called Pandemic EBT. So it's very similar in nature, but this is a permanent program that we intend on running every summer starting this year. So it is for school-age children. And it's really meant to replace part of the cost of food that students are missing because they're not in school during the summer. So helping families kind of lessen that gap of food cost while students are out. So those who are considered school age, which here in Oregon is the compulsory age for students to go to school, so 6 to 18 years old. School-age children that are receiving SNAP, TANF, or Medicaid benefits are automatically enrolled in the program and will automatically receive the benefit. For those who are not receiving SNAP, TANF, or Medicaid, they can apply for benefits to see if they are eligible. They do have to be enrolled in a school that participates in the National School Lunch Program, so a school that offers free or reduced price meals at school. And they have to meet financial eligibility, which is it's below 185% of the federal poverty level, which is the same income threshold that schools require if someone applies for free or reduced meals at the school. We will have an application available via the internet as well as a paper application, and that will be available at sebt.oregon.gov starting on July 1st. Next slide, please, Lily. All right, so summer EBT provides $120 for the entire summer for each eligible child. For our school-age kids that are receiving SNAP, TANF, or Medicaid, the benefits will automatically be issued onto their EBT card on June 28th, so in just a couple weeks. If the family happens to only have Oregon Health Plan, so they don't have an active EBT card, our system knows that, and we will be sending a new card out to them right after the benefits issue on the 28th. For those kids that apply by application, their eligibility decision will be determined, and if they're eligible, benefits will be issued within 30 days of us receiving that application. And if they are found eligible, benefits are issued onto a brand new EBT card and will be mailed to the address that's provided on the application. Next slide. And then finally, we have two really helpful websites that have been created for the program here in Oregon. So it's the same information. One is available in English, and then the other one is available in Spanish. And again, the same information. So the website includes really frequently asked questions. They can sign up for alerts via email or text message for when the application is available. So if they, opt into those messages, we will send them a text message or an email when the program is live and the application is available. There are resources for partners. So there's some really great, like if you're with a school or an organization, there's like newsletter inserts, there's flyers that can be customized for your agency, including a whole like brand kit that we have available. And then you can also sign up, shameless plug, for our webinar that is coming up here in a couple weeks. All right, so I will pause there. It looks like I have a couple questions in the chat. I will answer those in the chat, and then I will be here for the rest of this webinar in case there's any follow-up questions. Thanks, everyone.
Okay, I think it's back to me. Is that correct, Sean?
It will be for the next section, but do we want to handle some of Stephanie, the food-specific questions here? I think she said there were a couple.
Yeah, and I can answer, read them and answer them aloud if that's helpful.
That'd be great.
Sure. Okay. So the first question is, since this is a permanent summer program, where does the funding come from? And is this part of the government funding allocated to Oregon Medicaid? So this is federally funded. It does not come from Medicaid. So this is actually funded by the USDA Food and Nutrition Program. So the same program that runs SNAP here in the state of Oregon. The funding for the benefit amount, so the actual like food benefit that students receive, is 100% federally funded. And then the administrative cost to run the program are a 50-50 split between our federal partners at the USDA and then the state of Oregon. And I think that's the only question I have. But if there's any others, please let me know.
Okay, great. So the next section in our presentation is about questions that we have received over roughly the past month to our OHP Bridge inquiries inbox, basically. So we can go to the next slide, and I'll just do a quick reminder on that process. So we know that this the launch of OHP Bridge is going to be a huge lift for a lot of people, and so we wanted to create an efficient pathway for our community partners and assisters to send our team questions so we can get the answers back to you and out to everyone. We assume that if one person has a question, several people probably have it. So we have a couple different ways for people to submit questions to us. So one of them is through your ROCs, your regional outreach coordinators, through your CPOP program. The other is in writing through our OHP Bridge email, which is on the screen. And the third is by attending these office hours, which we also have a link to registering for that on the screen, and will go out in this slide deck. What we will then do is questions that are submitted up to a week prior to the office hours will be brought together, and we as a team will answer them, and then we will present the answers at this office hours, and then they will go out via this slide deck following that. So we really appreciate everybody that has sent questions so far, and we will go ahead and get started on that. And one last piece is that anything submitted a week prior to the office hours will be then added to the questions for the following month. Okay, we can go to the next slide. There we go. Okay, so question number 1 was regarding Medicare and OHP Bridge eligibility. So we had someone asking if somebody who is on Medicare would be eligible for OHP Bridge. And we just want to really clearly say no, OHP Bridge will not be available to people who have access to other health coverage. This includes Medicare. We can go on to the next slide. Regarding partner training, so we did, as Sean mentioned, we have a brand new partner training that is out and that we're very excited about, and a number of people have already started to take, which is great to see. We've had some questions about the length of the OHP Bridge on-demand partner training, and it should be about an hour long. It obviously depends on a couple of factors, but it should roughly take about an hour, and it's available at the links on the screen, and we have it in both English and Spanish. We can go on to the next question. There we go. So we had another question regarding the new income limit for a household of 1. So again, OHP Bridge covers people in between 138 and 200% of the federal poverty level for 2024. Sorry, for 2024, for a household of 1, that is roughly $30,000 a year. For a family of 4, that's roughly $62,000 a year. And again, in order to qualify, you must also not just meet the income eligibility, but you must also be between the ages of 19 and 64, a citizen or U.S. national, or have an eligible immigration status, and you must not have access to another form of affordable health coverage, which includes, again, employer-sponsored or Medicare coverage. And we've got more information at our website on the screen, and we encourage everyone to check that website out. It will continue to be developed, and more information will be posted as we head into launch and into July. Okay, next slide. So a similar question regarding public announcement materials. As Sean mentioned earlier, we do have a toolkit that's available at the Bridge website. We've got additional materials related to more general coverage outreach, which will include information related to OHP Bridge and links and resources that will be posted there and across our websites around July 1st, as well as that announcement event that we mentioned earlier in the presentation, which will happen around July 1st. Go to the next slide. Yeah, so we had another question. I really appreciate someone calling this out. We try to make our materials as clear as possible, but it's super helpful to get feedback to know when that has not happened, so we can make some edits. So we had a previous language in one of our flyers and outreach materials that stated that it was 200% of the federal poverty level through February 2025. And what we meant by that is that the federal government updates its FPL, or federal poverty level, every year. And so the numbers that are current that you might see on our website related to what 200% of the federal poverty level equals updates every year. So that 30,000 number that I mentioned before may increase next year. So the 200% limit itself will not change, but what 200% means according to federal guidelines will change every year. So we will try to update those numbers every year to make sure it's as accurate and easy to access as possible. And just to clarify, we've also updated the language on our website to try and make that clearer. We can go to the next slide. Okay, so contact information for OHP Bridge. So we've had some people reach out asking how individuals can get a hold of the team to ask questions. And so, as I mentioned before, we have the OHP Bridge email, which is there specifically for questions from community partners and assisters. That being said, we do want to clarify that if you are a member or potential member, that you should still reach out via the normal routes to get help. This includes through your One account, through the One customer service, or by finding a community partner via the Get Help link that's on the screen. So that OHP Bridge email is really for our community partners and assisters. It's managed by a pretty small team. And so if you're a potential member looking for more information, your One account and associated contacts are still the best way to get information quickly and effectively. I think the next question I'm handing over to you, Sean, is that right?
I think it's one more.
Oh, one more. Okay. So we had another question regarding OHP Bridge communications to individuals and who will be contacted and sort of the timeline. So I think we've kind of touched on notices so far, but if you are currently on OHP and will be moving to OHP Bridge, you will receive a notice in mid and late June. So you'll receive those 2 notices that we mentioned earlier in the presentation. And we have examples of those at the link on the screen that you can access in the slide deck afterwards. Otherwise, if you are newly eligible for Bridge following launch, then you will receive the same eligibility notices, cover letters, and member information from CCOs that you have received in the past. It will just be specific to OHP Bridge.
Alrighty, and then back over to me. Next slide.
Okay.
So will OHP Bridge have retroaction, referring to retroactive coverage for new applicants? The answer there is it depends. There are those 2 programs within OHP Bridge. Most members have the OHP Bridge Basic Health Program that will not offer retroactive coverage. The OHP Bridge Basic Medicaid, which is available to the people who are American Indian or Alaska Native, will have the option for retroactive coverage and follow the OHP rules there. So up to 3 months prior to the month you applied in, you still could get that retroactive coverage extended if you would have been eligible in the month you received the service. We also want to clarify that nobody will have access to retroactive coverage through the OHP Bridge program, specifically prior to July 1st when the program starts. So if someone applies in July and asks for bridge coverage or asks for retroactive coverage past July 1st, they would only get that if they would have been eligible for OHP based on income and whatnot before that. So there's a little bit of a complication right there. I also want to flag that this is a topic that the partner toolkit tries to explain, especially the timelines for the OHP Bridge Basic Health Program and Basic Medicaid graphics that are going to be added to that. So next slide. Are the immigration requirements still the same as listed on healthcare.gov? And the general answer there is yes. The immigration status requirements for OHP Bridge follows the same rules as Marketplace does. On this slide, I just wanted to take in one more time to thank the person who asked the question about the Magi Expanded Adult Program immigration status differences, where that one did have some different immigration status requirements that followed older traditional Medicaid rules about having 5 years of status first. We're going to get that outreach list campaign together and try to get those people reconnected after July. So stay tuned for our July topic on this office hours for that. Next slide. We got a question about the healthcare.gov/screener eligibility screening tool and whether that'll be updated for OHP Bridge. For the screening tool specifically, we do not expect that to be updated for state-specific programs. That includes Healthier Oregon as well as OHP Bridge and whatnot. Since we're using the federal platform, we have some limitations on how much we can customize tools to state-specific rules, though Oregon's making some moves on that in the future. The healthcare.gov eligibility system itself, so if you're applying through it though, in the vast majority of situations, it will correctly screen for and refer eligible people to OHP Bridge. One of the few situations we know where there might be some exception to that is people who are just above the income limit for the like between 200 and 205% of the poverty level. There might be a specific situation where it might not refer all people correctly. The vast majority of cases, yes, the eligibility system will work. The screening tool will not. For the screening tool function, we really want you going to the oregonhealthcare.gov/window shop, which is Oregon's specific screening tool / price estimator for marketplace plans and whatnot. But that will refer you correctly over to OHP Bridge as soon as the program launches on July 1st. So that would be really where I direct your attention if you're trying to screen someone's eligibility. Next slide. We got a question. Will individuals with OHP Bridge be eligible for long-term services and supports? So OHP Bridge does not cover long-term services and supports. It's one of the 2 exceptions, along with the health-related social needs benefits, where OHP Bridge benefits differ from OHP generally. However, we really want to encourage people in this income range to still apply. There are other Medicaid programs with higher income limits than OHP Bridge that people needing services may qualify for. There are also some other programs separate from OHP Bridge, we're talking about Oregon Project Independence here, where someone may be able to qualify for long-term services and supports separately from that. So still apply. Those use the same system. When you go through and request long-term care through the one eligibility system, it's going to screen you for all those programs. So really still encourage people to apply. The OHP Bridge itself does not cover long-term care. Next question. This one's about the transition to Medicare. If someone who is 64 gets accepted to the OHP Bridge program, then turns 65 later in the year, do they get kicked off when they turn 65? Answer there is, for most members, yes. OHP Bridge Basic Health Program would close at the end of the month of their 65th birthday. People who instead have OHP Bridge Basic Medicaid, so the Native American members, would keep coverage until the end of their continuous eligibility period, since they get those protections for 2 years. Everyone's going to be evaluated for other programs they may be eligible for, like Medicare savings programs, before their benefits close in that situation. And then on a similar topic, we've got one last question here. So this one's quite expansive. My hat off to whoever came up with this one. This really touches on every possible complicated topic we could ask for. So here's the question. For continuous eligibility, some individuals may still undergo an annual review. Could you please clarify who may be subject to an annual review? Furthermore, if a person becomes dual eligible for Medicaid and Medicare and exceeds income limits within that 2-year period, will those 2-year renewals still apply? So we've got 3 parts to this answer. First off is the current state. So right now, the system still assigns 1-year renewal dates, even if someone has continuous eligibility. The system's being updated, so the case renewal date will match the continuous eligibility date. That system update is currently scheduled for fall. We expect once that happens, the renewal dates will be set for at least 24 months for cases where everyone has continuous eligibility. In the meantime, we are actively moving renewal dates to prevent those renewals after 1 year for people who have continuous eligibility. So current state, it's in a bit of flux as we transition to those 2-year renewals. Next slide. We'll get more into who does this actually apply to. Continuous eligibility applies to nearly all OHP programs. Renewals will continue to occur annually for programs that don't have continuous eligibility, and here are those exceptions. There are some people who are receiving long-term services and supports who are not eligible for continuous eligibility. Specifically, 2 categories of OCP-M, which is that program we talked about earlier that is renewing over the summer, where people are over 65, blind, and have a disability. There are 2 categories within that offer people kind of expanded eligibility groups. There's one that allows people to qualify with higher incomes than the normal OHP limit, known as LTC Serve. And there's another for people in acute care settings, known as the OCP-M Acute Care Program. So those 2 specific types of assistance, continuous eligibility does not apply to, though many people with long-term services and supports will have continuous eligibility. So complicated answer there. And then the other major exception is going to be OHP Bridge Basic Medicaid. Sorry, OHP Bridge Basic Health Program. So most OHP Bridge members will have continuous eligibility and renew annually. That is the OHP Bridge Basic Health Program members. Their coverage is still protected, though, for 1 year if their income changes, though not if other changes occur. Non-financial things like other health coverage can still result in their benefits ending. The OHP Bridge Basic Medicaid members, who are the Native American, Alaska Native, or have parents or grandparents who are members of a tribe, something like that, they do get the full continuous eligibility protections for 2 years. So the two exceptions are certain long-term care programs and OHP Bridge, basic health program. And then the final component of this question was the Medicare transition. Next slide. Next slide. There we go. So just to restate that question portion, if a person becomes dual eligible for Medicaid and Medicare and exceeds income limits within the 2-year period, will 2-year renewal still apply? Short answer is yes. When a person who has continuous eligibility starts receiving Medicare, they will keep their full OHP coverage in addition to their Medicare for the remainder of that continuous eligibility period. They will also be screened for and might be eligible for Medicare savings programs that help pay their Medicare costs. So you want them to get in contact for that. Those Medicare savings programs also have continuous eligibility as well. But the main point there is that when someone starts Medicare, they are going to keep their coverage for the remainder of that continuous eligibility period. So hopefully that cleared up some of those issues that really touched on a bunch of complicated topics. That's the end of our main question response section. I think we're going to dive into the questions we got in the chat today next. Give us just a second to get organized.
Just about 3 minutes left, but please know that if we don't answer your question live today, that Lily is recording them and we'll be sending out in our follow-up materials the responses to those questions. So I will go through what we have. It looks like most of them were answered in the chat, but we do have one from Angelica. So will clients have to apply for OHP Bridge or will it be automatic? For example, if a mother doesn't qualify right now because of income, but the son does, will the system automatically add the mom to OHP Bridge, or should we be doing outreach to the families we work with?
In that situation, the mom would need to apply. There are different questions on the application that come up when someone's requesting medical benefits versus not, and we wouldn't necessarily have all that information on file. That person may have other health coverage and whatnot as well that they hadn't provided answers for. So we need to get that information in order to have them apply. I would say outreach would be the preferred solution there. We can't just automatically assume people want this coverage based on the income on the case or are eligible for this coverage. So thank you.
Great. And then we have a question from Grace. When will the OHP Bridge communication templates be ready for community partners? And Sean, I know you asked in the chat as a response to this, does this refer to things like the partner toolkit or the notice templates going out to new members? So I don't know if Grace, you're still in the meeting, if you'd like to come off mute and just clarify which one of those you're looking for.
Hi, my understanding through today's meeting, like most of the population, if they're uninsured, pretty much OHA is doing a lot of different flyer, right? Maybe posted to different area to raise the awareness of people can apply for OHP. But for the other one, my question is more tied to the people we be getting the communication. Is it the people went through the unwinding and we find out they're not eligible, they're eligible. We just want to see the template of those communication notice. Does that make sense?
So there's people that kept OHP during the pandemic unwinding until OHP Bridge launches. We've got a couple questions in this, a couple slides in this whole presentation have the link to that transition letter that's going out to members that are moving to OHP Bridge in July. So that's the template that's going to those members. The other parts that were mentioned, if they didn't keep coverage during their renewals during the pandemic and lost coverage and something has changed or something, we would need them to reapply. That's really what we're intending that general health coverage, get it, use it, keep it ad campaign to do, as opposed to specifically reaching out to members. So, because we wouldn't know if their income has changed since they lost coverage and they haven't told us because they don't have to report anymore. The partner toolkit is really intended to support your outreach. Hopefully those documents meet the need you're describing. Does that? Did I answer the question?
I can look into the toolkit. Thank you.
I'll drop that transition notice link in the chat again.
And we are actually at time for today's session. So again, we'll be including information in our follow-up email for anything that wasn't answered live today. Our next meeting is going to be on July 9th from 1 to 2 p.m. So in this same time slot, and just be on the lookout for more information from us coming by email. And thank you everyone for joining today.
Thank you, everyone.